Ken Tanabe. I have the great privilege to serve as the president of the Society of Surgical Oncology. I have with me Dr. Casey Allen, who's heading up our value task force, and they are doing a lot of interesting and great things. I thought it'd be a great opportunity to talk with Dr. Allen and learn a bit about what they're up to. Dr. Allen, may I ask you to introduce yourself?
Absolutely. Thank you, Dr. Tanabe. So, like you mentioned, I'm Casey Allen. I'm a GI surgical oncologist in Pittsburgh, Pennsylvania. I work at the Allegheny Health Network, um, and I've been working with the SSO with the Value Task Force. I'm looking forward to discussing that today.
Terrific. So maybe you can tell us a little bit about why the SSO felt the need to create the Value Task Force, or how did it come to fruition?
Now, that's a great question. So, it really came from the recognition that the healthcare landscape is continuing to evolve and change pretty substantially. So while the quality committee has done, a great job and continues to do a great job focusing on improving outcomes, value really expands that lens. It incorporates not just the outcomes, but also cost, patient experience, and other dimensions that matter to patients in the system. So I'm sure everyone's realized that as surgeons, even surgeons, we're increasingly practicing within this evolving healthcare landscape. And whether we like it or not, there's a sense that we need to become more involved in cost efficiencies, cost effectiveness, and developing a more organized surgeon-led effort within the SSO. We felt was important. So we created the Value Task Force, really just to bring structure to all that, to develop a unified approach around member education, to create opportunities for research collaboration, and to start building programs that actually operationalize value-based care in surgical oncology. And I also think importantly, it creates a platform for surgeons, surgical oncologists to collaborate in this space as well.
Yeah, terrific. I agree. There's a lot of interest amongst surgeons, surgical oncologists in this area. You mentioned programs. Maybe you can share with us a program or a project or two that the Value Task Force identified as, good, appropriate for the SSO to undertake in the value-based care arena.
Yeah, so when we first came together, we put out a call for applications to get members involved with the task force, and we received a lot of interest. And we have now about a dozen members within the task force, and everyone has there are different stages of their career. They've all had different experiences, but they've all are all very interested and almost experts in their own way within value-based care. At the advent of the group, we brainstormed what the task force might look like within the SSO, and we identified plenty of opportunities, lots of ideas. But we really wanted to be very intentional about how we started with a few core initiatives. So we went to the executive committee and we discussed with them as well. And we felt that the best first charge was really around education and awareness. So just getting surgical oncologists comfortable with what value-based care means. So we've done a lot of work in that arena. So we've done a podcast series through Surgeon Today, and we've also did some programming through the annual meeting at the SSO. So obviously, we just had the SSO meeting with 3 panelist sessions. So hopefully, people were able to attend several of those. And if not, that content is available online. And then all the podcasts have been recorded, and 2 have been published so far on Surgeon Today. And generally, the content, both the sessions and the podcasts, focus on the basics of value-based care, how to apply it in surgical oncology, perspectives across stakeholders, and then a broad spectrum of related topics such as health equity, access, advocacy, and healthcare economics. We're also now completing a comprehensive manuscript that will be published in the Annals of Surgical Oncology that defines value in surgical oncology, what it is, how we can deliver value-based care and get involved, and how we should all be thinking and collaborating moving forward. And sort of our next step, and I'll talk more on it, is really moving away from education and awareness and more into implementation focused work. So a couple of our members have developed micro learning around coding. We're developing a value-based care curriculum in collaboration with UT Austin and their Value Institute. And we're working alongside the quality committee, continuing to work within the quality committee on a national initiative around value-based care decision making for complex cancer surgery. We're starting to develop these initiatives. We're also trying to engage patient advocates. A lot of different national organizations have patient family advisory committees, PFACs. FSO does not. We're looking to engage patients as we relate to, patient-centric value-based care delivery.
That's terrific. Let me ask you. So you've talked in a lot of general terms. We have surgeons that are specialists in hepatobiliary surgery, surgeons that are specialists in melanoma surgery, and they think to themselves, well, is this broadly applicable, and is it applicable to me in my, focused practice, since we have both types of practices?
From my understanding, this value-based care delivery is going to permeate all surgeons, all healthcare providers, whether you're melanoma, sarcoma, hepatobiliary, being conscious of your efficiencies, your cost, um, in relation to the outcomes that you deliver are going to be more and more important as our healthcare landscape develops. I don't know if people know, but the healthcare system is financially is fiscally challenged. We'll say it that way, and we're constantly being challenged ourselves to deliver care faster, cheaper, more effectively, while maintaining the same outcome profile. So, it's going to permeate all fields of surgical oncology. And I think that the task force is a great opportunity for people not to just become educated, but then also to become engaged as well.
So what I think I'm hearing you say is that this is super valuable whether you have a very focused practice or a broad practice. Super valuable whether you're an HPV surgeon or a breast surgeon or a melanoma surgeon. Super valuable whether you are a resident in training and a member of the SSO, or have a mature practice, sort of cuts across all of these constituents. Is that fair to say?
Very fair. Absolutely.
So right now, the Value Task Force is under the oversight of the Quality Committee. How has the task force evolved to distinguish its work from the Quality Committee?
That is a work in progress. Absolutely. So, the way we see it is it's very complementary to quality, the quality committee. It sits within quality conceptually because value is basically quality over cost. And the quality committee has done a lot of work focusing on, consensus guidelines, improving outcomes, making sure we're delivering high quality evidence-based care. And what the value group, the value task force ideally is trying to accomplish is bringing into the cost side of the equation. So not just the cost of the patient, but institution, payers, and society as a whole. So really the interplay of quality and cost. And I think I mentioned this before, but as surgeons, we're increasingly expecting not just how we deliver the best care, but how to do so in a way that's efficient, reduces unnecessary variation, and also aligned with our broader system growth, our broader system goals, such as our institution or organization. So it's not meant to replace or duplicate the quality. It's really trying to build upon it. And it's really an additional, more of an effort to integrate cost awareness and system level thinking into how we deliver surgical oncology care.
Well, it's certainly within the domain of what the Quality Committee had been doing, but I think that there's just so much more that, for example, what you've just explained, that can be done, that having it its own entity, I think, makes a lot of sense. And also, the Quality Committee is tasked with a lot as it is, and
Yeah.
it's almost overwhelming. So I can certainly appreciate that. Thank you. So, what can SSO members take back to their institution based on what the Value Task Force is developing?
So I think there's a lot, and it's probably hard to distill it down to a single takeaway. But at a minimum, we would encourage members to engage the content that we've already developed. So the podcasts I thought were very well done and are very comprehensive. Also, our sessions at the SSO or reviewing the content from the SSO meeting on the website is another opportunity to become more well informed. And then also keep an eye out for the manuscript that's going to be published in the Annals of Surgical Oncology. Additionally, we're also developing a formal value-based care curriculum, like I mentioned, in collaboration with UT Austin. And I would encourage members to keep an eye out for that as another way to build on their understanding and get more engaged in this space. And then I think actually, if there was one thing to take away, I would say if there's something a member is interested in, an idea, value-based care, or any of the the content within that. We'd absolutely love to work with you. So I encourage you to get involved, reach out to myself or anyone within the quality committee, because we are looking to evolve this into more of a long-term, potentially a formal committee over time with opportunities for continued member engagement, similar to other SSO committees.
That's terrific. So you're saying if someone out there has a thought about something they'd like to pursue in value-based care, they can just reach out and contact you directly. Yeah.
Yep, yep. We've had members that were not originally part of the task force who had great ideas and wanted to work with us, and that's been very beneficial. So please, that would be great.
The curriculum that you mentioned, what do you see as the future of how is that curriculum going to be used?
So UT Austin, a few years ago, as part of the invited presidential lecture, Elizabeth Teisberg gave a talk on value-based care and surgical oncology. She's one of the original authors of the textbook alongside Michael Porter on delivering value-based care in healthcare. And she gave a great discussion. And she had led this institute, the value-based institute at UT Austin, after she broke away from Harvard. And this is to engage healthcare providers into better educating themselves into how to deliver value-based care within their institutions. Now, after people attend that course, they can actually continue to collaborate with UT Austin's on projects that they want to engage within their own institutions. So our long-term goal is to develop sort of a pipeline for education for SSO members, but then also add an avenue to collaborate with other experts in the field to develop programs potentially within our individual institutions, organizations, or within the SSO more broadly. And I can talk more in detail on that, but that's generally what we're looking to do.
Also sounds like a great topic for one of the peer network groups that Dr. Berman recently launched during his presidential year, where I think a lot of surgeons who are interested in value-based care can get together, gather, meet on a regular basis, and help each other move these types of projects along. So I think note to self, be sure to mention that to Dr. Berman to make sure that we have a peer network group set up around that.
All right. Thank you.
Yeah, thank you, Dr. Allen. This has really been very enlightening. Thank you very much for the work that you're doing and that your task force is doing. And we look forward to hearing a lot more in the future.
Happy to be here. Thanks for having me.